Children ages 5 to 11 will soon be eligible for a COVID-19 shot.
Today, the White House unveiled its plan to roll out the vaccine for young kids immediately after it's approved by the FDA. News 8's Dana Marie McNichol has more on this detailed plan.
Now, the CDC and the FDA will be discussing this over the next 2 weeks, whether to approve it or not. The White House expects a decision on November 3rd. The Biden administration has already bought 65 million pediatric doses of the Pfizer vaccine. Within days of FDA approval, the White House says the vaccine will be ready for the arms of 28 million children.
At first, I thought the White House sort of got out ahead of the game again before the FDA and the CDC really reviewed the data and made a recommendation. But I understand the need to prepare people. This is a big change. We need parents to start thinking about where they're going to get their kids vaccinated.
Dr. Mark Sawyer is an infectious disease specialist with Rady's Children's Hospital. He thinks an approval is coming our way. The Pfizer vaccine for kids 5 to 11 will be administered with a smaller needle, and the dose is made specifically for this age group.
The dose is 1/3 the dose that older adolescents and adults are getting. But it's the same 2-dose vaccine 3 weeks apart.
Last month, Pfizer tested the smaller COVID-19 vaccine doses on 2,268 patients between the ages of 5 and 11. They say the trial was safe and generated a robust antibody response.
I expect access to not be a major problem. The county health department is looking right now to make sure that we have sites around the community to serve the population.
The administration looks to make vaccinations more convenient for families with clinics at doctors' offices, hospitals, pharmacies, community health centers, and even schools. Nationwide, more than 25,000 pediatric and primary care providers have already signed on to dispense the vaccine.
There's no doubt that COVID is serious in children. We've had several hundred kids in the hospital at Rady Children's Hospital, including 70 in the intensive care unit. Parents need to understand that this is a potentially serious problem in children. And as long as the vaccine is safe and effective, the best way to get kids back to normal activity is to get them immunized.
The Biden administration says states will continue to get support, including full reimbursement for vaccine and outreach programs.